The federal government defines emotional behavioral disorders as an inability to learn unexplained by intellectual, sensory, or health factors, inability to build or maintain relationship with peers and teachers, inappropriate types of behavior or feelings under normal circumstances, general mood of unhappiness or depression, tendency to develop physical symptoms or fears associated with personal or school problems. In the following slides, I have listed some common emotional and behavioral disorders, as well as their characteristics and the impact of those characteristics on the student and their surroundings. There are three main methods in identifying students with emotional and behavioral disorders. The first, Student Risk Screening Scale, is a 7-item rating scale. It includes steals, lies, cheats, sneaks, negative attitude, low academic achievement, peer problems, behavior problems, and aggressive behavior. It detects antisocial behavior through teachers rating children on a Likert-type scale, going from 0 to 3. 0 meaning these events never happen, and 3 meaning they happen frequently. The rating from each of these categories is added up to define the student's risk. If a student is scored from 0 to 3, they are considered at low risk. From 4 to 8, moderate risk, and anywhere from 9 to 21, they have a high risk for an emotional or behavioral disorder. The SDQ, or Strengths and Difficulties Questionnaire, is also used in identifying students with emotional and behavioral disorders. It has a wider age range than the SRSS and goes across 5 domains: emotional symptoms, conduct problems, hyperactivity, peer problems, and prosocial problems. The screener presents the parent, teacher, and student with 25 questions that they can rate anywhere from not true, somewhat true, to certainly true. Students are then classified in each domain as normal, borderline, or abnormal. The third type of identifier, as long as the most popular, is the systematic screening for behavior disorders. It's a 3-step procedure. Stage 1, the teachers rank all students on externalizing or internalizing behavior. The top 3 students in each category move to Stage 2. In Stage 2, teachers use the Critical Event Index and the Combined Frequency Index to evaluate students regarding specific behaviors. Students outside the cutoff scores proceed to Stage 3. In Stage 3, school professionals conduct a systematic observation of academic engaged time in a variety of different environments. Based on what the professionals decide, a student will either be identified or not as having an emotional or behavioral disorder. There are a number of strategies to help students with emotional and behavioral disorders engage in class. One example is providing them with a temporary escape. A temporary escape is a temporary removal of a student from a volatile situation. In order to do this successfully, a teacher must be aware of changes in student behavior and certain triggers of that behavior. For example, provide a student with a mental break by talking about something unrelated to school or the volatile situation. Another proactive strategy is eye contact. Gaining eye contact can increase compliance and understanding between the student and teacher. It ensures that the student understands that the teacher really cares about making a connection with them. Making an eye contact with a distracted student can make them realize that their mind was wandering and focus back on their task. Another strategy is setting up a rule reminder. Classroom rules are used to ensure students understand the importance of keeping the classroom a safe environment that cultivates academic success. For example, create a poster on the wall of all the classroom rules and go over the rules consistently with the students so they understand their expectations. It is important for teachers to understand the idea of proximity control. A teacher must be actively moving in and around the classroom to ensure that students are reminded of the teacher's expectations and the authority. For example, when handing out a test, having a teacher walk around and look at the test will remind a distracted student to focus on their task. The final strategy is to praise appropriate behavior. It is important to consistently praise the student when they exhibit good behavior, as well as ignore the child, if possible, if they are exhibiting bad behavior. Ignoring the student works best for externalized behaviors. You have to be cautious using this technique with students who internalize. For example, if a student goes through the whole day without getting upset at anyone, then you want to make sure to mention that to them at the end of the day and how proud you are of them for completing the day. It also can occur frequently. If you see a student in a potentially volatile situation and they handle it appropriately, make sure to show how proud you are of them in that very moment. 3 academic evidence-based supports for children with emotional and behavioral disorders are small group work, self-regulated strategy development, and progress monitoring. Small group work is a way to get students to be able to focus better on their work as well as receive one-on-one attention from their teachers. These small groups lessen the potential for social anxiety as well as allow students to watch and learn appropriate behaviors from their peers. The second academic evidence-based support is the SRSD. It's a method for developing self-regulation that can help in writing and in social situations. It's a 6-step process. The first step is to develop background knowledge, finding out which skills are lacking to complete the task. The second step is to discuss it. Tell the students how and when to use certain learning strategies, as well as how they can help. Teach students how to perform self-monitoring so they can track their own progress, making it more satisfying when they reach their goals. The third step is to model it. Demonstrate the thought processes of the strategy to the child in steps. Explain why each of the steps are necessary. Fourth is to memorize it. Learn the steps of the strategy and what happens in each step. Make sure that the processes are occurring naturally so it will be easy to apply them to other situations. The fifth step is to support it. Write out and clearly define goals for self-regulations to make sure they keep their focus on obtaining their achievements. Guide students, but modulate the teacher interventions so they gain more independence. The final step is to establish independent practice. Monitor performance, and make sure to use lesson plans that incorporate the writing strategy into everyday work for the students so they can continue to improve. The last academic evidence-based support is progress monitoring. A system for progress monitoring and goal setting is beneficial to the child and the instructor. It allows the instructor to see which methods are working best for the child and provides an incentive for the child to achieve the appropriate behavior. It is important that the goals be challenging yet attainable so the child feels satisfaction when completing them, but not overwhelmed by the task. There are also behavioral evidence-based supports. The first one is positive reinforcement. It's the same idea as praising appropriate behavior. Every time a student completes a task or does something positive, it is important to make them feel rewarded for it. This will then change to intrinsic motivation, where the student will want to do the right thing for his or her own self. It is important to be consistent and specific. For example, if someone who always forgets their pencil brings one to class, say, "I am so proud of you for remembering all of your supplies for class," instead of just saying, "Good job." Another method is the check and connect. It refers to having a student checking in with a mentor at the beginning and end of every day. This mentor will help them sort out any struggle or questions they had throughout the day, as well as track their progress throughout the year. A functional behavioral assessment, or FBA, works to define the function of a behavior so we can then develop a behavioral intervention plan to find the best replacement behavior for the student's problem. The first step in conducting an FBA is to identify the target behavior. It is important to be specific and objective when identifying the behavior. You should consider how long the behavior has been present, environmental factors, the child's skill level, and when and where the behavior is occurring. Next, you need to collect data. Collecting data helps to define the behavior, record the child's actions, and evaluate the outcomes of intervention plans. It is also important to collect data from many sources and consider past and informal assessments and tests. Based on that data, the next step is to generate a hypothesis. Consider where and when the behavior is occurring, as well as with whom. This will help determine the function of the behavior, such as to obtain something desired or to escape or avoid a situation. Develop a statement that includes the interfering behavior, setting events, immediate antecedents and consequences, and the function of the behavior. Next, you must test your hypothesis by setting up a volatile environment for the child to ensure you understand the causes and the function of their problem behavior. Based on the validity of your hypothesis and from the data collected, develop a behavioral intervention plan. In order to implement a successful behavioral intervention plan, you must first define the target behavior. The target behavior should already be defined from the FBA. The next step is to implement practices to decrease the behavior, like the ones mentioned earlier. The next step is teach a replacement behavior and encourage its use in different situations. A BIP also increases learning opportunities by slowly exposing the student to stressful situations in order to encourage the replacement behavior. It is important to focus on developing skills needed to handle certain situations, rather than just managing one behavior. It's also important that the objective of the BIP be observable and manageable, so you can track the progress and ensure you are implementing the proper interventions.